Good evening, dear viewers, and welcome to another episode of Medical Talk, where we continue to explore important medical topics that shape the health of our families and communities. Today's episode focuses on widespread yet often silent condition, high blood lipids, including cholesterol and triglycerides. These markers, when elevated, can significantly affect heart health, increase the risk of arterial blockage, and rise the likelihood of heart attack and strokes, some of the leading causes of mortality worldwide. To help us better understand the causes, risks, and modern strategies for managing lipid disorders, we are honored to welcome Dr. Ahmad Alsarraf, a consultant clinical lipidologist. Together, we will discuss how lipid levels rise, how they influence the heart and blood vessels, and what steps can be taken to prevent long-term complications. Stay tuned, you're watching Medical Talk. Welcome back. We're happy to have with us in the studio Dr. Ahmad Alsarraf, a consultant clinical lipidologist. Dr. Ahmad, we are happy to have you. Welcome to Medical Talk.
Thank you.
Thank you so much. I have so many questions, okay?
Go ahead.
Think of me as one of your patients,
Sure.
not just a colleague, okay?
Yeah.
Okay, so we start off, can you explain to our viewers what blood lipids are and why they play such an important role in the body?
So let's make it simple.
Yes.
Fat, it comes from two sources. 20% that we eat.
Yes.
80% produced from the liver. Okay? Fat is very important and essential for our body. It can provide us energy. It's nutrition for our cells. In addition, producing hormones. Lipid profile includes total cholesterol, triglycerides, HDL, which high density lipoprotein, which let's say it the good cholesterol, and low density lipoprotein, which gonna say it bad cholesterols. This is very important. This is very important as a baseline. We use it for the patients to check what type of high cholesterol does he has. Does he has a high total cholesterol or high triglycerides? Based on that, we can say what is the diagnosis.
I see.
Later on, we can use the lipid profile for the management. And what is the best management for this kind of patients?
Yes. So it's interesting that you mentioned that lipids can actually come from two sources, and a lot of people, they don't know that actually our bodies does produce.
That's true,
it.
yes.
So
80% is come from the liver. It's only 20% that the type that we eat.
that's significant.
So that the producing, that's as you know that we discussed it before that. Fatty livers is very common now in Kuwait.
Yes.
Okay, that's because it's producing a fat more and more. So that's again 80% that producing from the liver. Only 20% that's what we eat.
I'm sure you get this question a lot from your patients. Why are high cholesterol and high triglycerides considered major risk factors for heart disease and arterial blockage?
So as you know, cardiovascular disease is the leading cause of disease, disability, and death. Globally, around 18 million died every year due to cardiovascular disease. In Kuwait, every year, 4,000 died due to cardiovascular disease. 43% the cause of mortality here in Kuwait is due to cardiovascular disease. And they found that 9 risk factors such as diabetes, hypertension, physical inactivity, smoking, and hyperlipidemia. But they found that 70% of these patients, they have 2 main risk factors, which is hyperlipidemia and smoking. So that's why hyperlipidemia is a major risk factor for cardiovascular disease and the stroke. Don't forget this one.
Yes, I was going to tell you that.
It's not only heart attack, not only cardiovascular, also stroke.
It's quite serious condition, and as we mentioned in the introduction earlier, it's what we call the silent condition. But what are the most common causes of high lipid levels? Like, is it lifestyle or is it genetics?
So let's divide it. It's a primary and secondary.
Okay.
So primary genetics, such as familial hypercholesterolemia, familial combined hyperlipidemia, or familial chylomicronemia, which is high triglycerides. So that genetic, there is a defect in one part or one source of the genes. So it comes from the family and following for their children's and grandchildren's. And we should not ignore the secondary causes. We can divide the secondary causes into diseases such as hypothyroidism, renal disease, liver disease. All this one may lead to hyperlipidemia. Don't forget medications with certain medication can also increase high cholesterol, and physical activity, obesity also may lead to high cholesterol and high triglycerides.
I'm glad that you mentioned obesity and basically the smoking earlier. How do factors such as poor diet and physical inactivity and smoking actually contribute to rising cholesterol and triglyceride levels?
Do you know that 70% of our population are obese?
Yeah, we lead
very high.
We lead the scale.
That's unfortunately we are
yeah.
either number 1 or number 2 in the world.
Given the small population that we have.
With the 1.5 million.
Yeah.
Obesity is very high here in Kuwait. So obesity, physical inactivities may lead to high cholesterol, either the total cholesterol and triglycerides. Once you increase your body index, the fat is produced more and more. That increases the LDL, which is the bad cholesterol in your body. So physical inactivity, obesities, also they lead to high cholesterol and triglycerides in the lipid profile.
Okay. You mentioned earlier the good cholesterol and the bad cholesterol, and a lot of people, they don't know the difference between them. And can you explain to our viewers, what do we mean by like either good or bad? Is there, where do they come from?
So as you know that most of them comes from the liver. Okay,
both of them?
Both of them. The LDL, the low density lipoprotein, and the high density lipoproteins. Inside their core is carrying the cholesterols, either cholesterol ester and triglycerides. LDL cholesterols
is the bad one.
The bad one, which have the ability to stay more in the arteries. That may lead to atherosclerosis in the future. Okay, that's all may lead also to the stroke. While let's make it simple for the viewers. HDL, like imagine like a garbage truck, okay, which taking the cholesterol from your body, take it back to the livers for regenerations. Okay, unfortunately, the LDL cholesterol has the ability to stay more and to stay in the arteries. That leads to atherosclerosis.
Exactly. So we need the HDL.
Yes.
And less of the LDL.
Yes.
Okay.
And that's why we go back to your questions, because obesity, unfortunately, most of the obese patients, they have low HDL. That's why they have more LDL than HDL.
It's interesting that when you mentioned earlier, like it's only 20% comes from external factor, and that's only the 20% that we control.
Yes.
And that could actually cause significant damage to your body.
That's true.
Adding to that smoking and lifestyle.
Yes. All this one can lead to cardiovascular disease.
Now, in terms of this condition, I have so many questions, but I want to ask one more question before we go to break. Do you see it in a certain category or group of people, like maybe like certain age, or is it going to be like from a young generation you can see it?
Nowadays in Kuwait, you can see it in all ages. Like unfortunately, 77% of our girls are obese or overweight. Children's like below 10, if you go to their schools, like 1 out of 4 or 1 out of 5, they are obese. Okay, elderly, because of less activities, they don't do any activities, they don't go to the gyms. Okay, unfortunately, they are obese. So you can see it in all ages.
We still have more questions, but we have a short break and a report we will watch. We'll be right back. Stay with us. Welcome back. We're still talking in the studio to Dr. Ahmad Alsarraf. Dr. Ahmad, before the break, we were talking about the risk factors of high cholesterol and high lipids, basically in general. I want to ask you about the most effective modern treatments available nowadays for managing high lipids levels, including medications, obviously lifestyle changes, and advanced therapies.
So before that, we have to divide our patients, okay, either to high risk, moderate risk, very high risk, and low risk. Usually very high risk, they have a history of cardiovascular disease, like for example, myocardial infarction, transient ischemic attack, a stroke. All these we classify them as very high risk. And the target for these patients should be LDL below 1.4.
Okay.
Based on these categories, we give the best management. For example, for low risk, usually we don't start medications.
Right away, don't.
We don't. Recommendation, therapeutic lifestyle, which include physical activity and decrease your fat intake. We don't advise to stop fat. low fat intake.
Okay.
Low fat diet is very important, less than 20%, because as we say, fat is essential for our body.
Yes.
We need it.
Yeah.
Okay, so therapeutic lifestyle, but for patients with high risk, very high risk, medications is important.
Yeah.
Okay, the first line for our medications is something called statin, which is pills. Take it daily in the night before you sleep, and certain drugs of statin you can take it anytime. If the patient did not reach the target, we may add something called ezetimibe, which can decrease LDL, the bad cholesterol, up to 20%. If the patient has any side effect of these medications or still did not reach the target for the LDL, we can now prescribe injection, something called PCSK9 inhibitors, which can give it to the patients every 2 weeks or once a month, or now certain injections we can give it every 6 months, which is it's called small interfering RNA. All these medication, thanks God, that is available here in Kuwait, and we can prescribe it for these patients.
What is the most misconceptions associated with statin? Because there's a lot of issue about, oh doctor, I don't want to take statin, because
as you know, Dwania is the second doctor here in Kuwait. Okay, so when they stay in they sit in Dwania, they discuss, I don't feel well with this type of statin medications. Most of the statins is safe, and they don't have any side effects. Only 10% of these patients may have like something called muscle pain or myalgias. Okay, liver is safe, renal is safe. Certain patients that complain about cognitives. Yes, I have a memory loss, or that may lead Alzheimer. All these studies, okay, with the new publication, they said no.
There's no association.
No association with Alzheimer, no association with dementia at all. Only the major side effect from these statins is muscle pain. So again, these medications is essential for the high risk, very high risk patients. The first line of medications is of patient with cardiovascular disease is a statin.
I see. Okay. Now, how can early screening and regular blood testing help prevent cardiovascular events, especially for individuals, as you mentioned, with family history, high cholesterol? So
most of the recommendation and guidelines from the world, they recommend to do a lipid profile at age 40, or even earlier if the patient has a family history, either hyperlipidemia, hypercholesterolemia, hypertriglyceridemias, or family history of a premature cardiovascular disease. So it's recommended to do a lipid profile earlier. And nowadays, by the way, I forgot to say it, lipid profile no need to be fasting.
Okay. Because that's another question, because a lot of people, they think that they need to
No. That's the new recommendation. You don't need to be fasting to do a lipid profile.
And is the calibration is accurate?
Is accurate. Only the problem is if your triglycerides is high, it is recommended to do a lipid profile on a fasting stage.
To get a more accurate...
Yes, because mainly triglyceride comes from our food. Okay, to get accurate result, so you need to be fasting. If triglyceride is normal, you don't need to be fasting at all.
I'm glad that you mentioned food, because this is, I think, the main question that usually patients come to your clinic and they want to help, but they don't know where to start. So if a patient comes to you in the clinic, then they ask you which lifestyle adjustments regarding nutrition, activity levels, and weight management have the strongest impact on lowering the lipid level.
So as you know, the body is based on the body mass index.
Yes.
Okay. So based on body mass index, we're gonna know that patient is ideal, overweight, obese. Okay. So most of the recommendation don't do a massive weight loss. Okay. So try to lose weight around 1 kg or 1.5 kg per week. Okay, so slowly go with reducing your weight. Eat whatever you like, but in moderation.
Yes.
Okay, so based on your calories intakes, you can eat. For example, in a cheat day, you want to eat a cheeseburger, go ahead, eat cheeseburger, but not daily.
Yeah.
That is a must. Yeah, you have to be on low-fat diet, 6 days. You can cheat in 1 day, so you can eat cheeseburger, the food that you like. Exercise is very important, not only for a patient with the hyperlipidemia, but also for a healthy patient, for healthy people. exercise for at least 30 minutes, any type of exercise you like per day, okay, 5 times a week, 5 times a week is important for everyone.
Doesn't matter if it's cardio or...
It's for everyone.
Okay.
30 minutes, any type of exercise you like.
Just normal walking
Yes.
could be...
Yes, this type of exercise, but continuous. Don't say, yeah, I walk for 5 minutes and rest, 10 minutes and rest. No, it's preferable to do exercise for at least 30 minutes continuously.
What about sleeping? Does that actually affect also?
Yes.
Yeah.
At least like 6 to 8 hours a day. It will affect your cognitives. It's going to affect your body. It's going to also affect your heart.
Is there any campaigns or awareness that happens in Kuwait, like on an annual basis?
Yes, in Amiri Hospital, because I'm part of the Subah Al Ahmed Cardiac Center, every year, September and end of September or early week of October, we have a campaign for a whole week. We advise the attendants about why hyperlipidemia is dangerous to your heart, what are the exercise you have to do, what type of food you need to eat. All this one in this 1 week campaigns.
And you mentioned earlier that usually that starts in the age of 40.
Yes.
So that's screening.
Or earlier.
Or earlier.
If patient has a family history of hyperlipidemia or premature cardiovascular disease.
And these screening tests are free, basically, for the public to...
Yes, for Kuwaitis, yes.
Yeah.
It's a free.
Yeah. Now, my second question is that we see a variety condition between males and females. Osteoporosis, for example, is more prevalent in females than males. Now, does high lipid has more prevalence in males or females?
It's almost equal, but female taking care of themselves more than male.
Because?
Because of the pregnancy.
Yeah.
So they do the blood check more frequently than male.
Okay, so they kind of catch it earlier.
Yes.
They be able to catch it earlier.
Yes.
Plus the estrogen, basically, that basically helps regenerate everything.
And as you know, that is there are some features, okay, or some symptom and sign.
Yeah.
It's very obvious for patient with hyperlipidemia, especially for primary. For example, like have arcus cornealis, like a rim inside the eyes, xanthelasma, like white discolorations here are under the eye.
Yeah.
Okay, so that is very obvious, and they can see it more with a woman than men.
Oh, so they can be spotted by their dermatologists sometimes, you know, or ophthalmologists.
Yes.
They can actually see.
And they refer it to me because they have high cholesterol for that.
See, this is my next question, because a lot of people, they don't know where to start, where to go. Usually, if they want to start with the basic line, who should they approach? Is it internal medicine? Is it?
So the simple thing, easy thing, go to the polyclinic, okay, of your area, ask for a lipid profile. And again, not fasting is not a must. Yeah. You go there, I want to check my lipid profile because I have a family history, I'm above 40, I want to check my lipid profile. Simple thing. If it is highest, they have the risk score. Based on the risk score or history, they classify this patient either high risk, low risk, moderate risk, or very high risk patients.
And whether they refer them back for further testing and further examination, basically in the hospital.
Correct.
But mostly, and correct me if I'm wrong, nowadays we have clinics in the polyclinics, you know, that they can handle this.
Yes.
Most of the treatment for the moderate cases.
Correct. Now most of the polyclinic, they have something called non-communicable diseases, which they can treat and manage patient with high diabetes mellitus, hypertension, hyperlipidemia, and other conditions like, for example, respiratories and obesities. If the patient have very high cholesterol, so they refer it for me, so I can do for them genetic testing, and they do cascade screening for this type of family.
I have one more question before we close. Does seafood or shrimp in particular are innocent or guilty?
Innocent.
Because there's a misconception that, you know, if you have a high cholesterol, you shouldn't eat seafood, you shouldn't eat salmon, you shouldn't eat.
No, salmon has has omega-3 fatty acid. Yeah, it's essential in your food. Should take it once or twice a week. Yeah. Okay, shrimp, if you like to take it and you have high cholesterol, you can take it. You can eat it, but not daily. Yeah. For example, every 2 times per month. Egg, you can eat egg. Yeah. It's innocent. Yeah. Food is innocent, but what kind of food you can cook it with it?
I see.
Okay, so most of my patients, I advise them to take, for example, like olive oils, okay, or like the free dryers,
Air fryer.
air fryers.
Yeah, air
So
fryers.
most of these one, I recommend them.
Yeah.
So focus about the protein intake, less carbs.
Got it.
This is very important. It's very, very essential, even for healthy people.
Yeah.
More protein, less carbs.
You see, the problem is they're diverting from the protein because they
That's
think
correct.
it could cause increase. They're like meat, for example. They don't want to eat meat because they think that will increase their cholesterol.
No, no. You can eat meat once a week or twice a week.
Yeah.
Make your food like this: chicken, fish, okay, vegetables,
Variety,
and
basically,
yes, and meat. If you like meat, you can eat meat, but once a week.
Yeah, exactly. And you can have protein from vegetables as well.
That's correct.
Yeah, from beans and other sources. Before we finish, if there is one last word that you want to give to our viewers, what would it be?
Exercise is a must. 30 minutes at least per day for five times a week. Low-fat diet, not only for hyperlipidemic patients, also for healthy people. And please, please stop smoking.
Yes.
Oh, don't smoke.
Don't smoke, exactly. Dr. Ahmad Alsarraf, thank you so much for your valuable information that you shared with us. Thank you for your time.
Thank
and
you.
hopefully we'll be able to host you again in Medical Talk.
Thank you.
Thank you. Dear viewers, we still have more. Stay with us. We'll be right back. And now, dear viewers, family health means more than treating illnesses. It's about living with awareness every day. Healthy habits, regular checkups, and good communication at home make all the difference for a stronger, healthier family. Let's move now to our family health tips.
Hello everyone. Today we'll be talking about fiber and the importance of fiber. Now, fiber might be one of the most underrated nutrients there is out there. People forget how important it is and how much we need of it. Now, when you look at fiber, it has many benefits, but those that have diabetes, blood issues, or cholesterol, or even heart disease really need to consider how much fiber they should be taking in. Now, we're usually looking at around 25 grams of fiber per day for women and about 38 grams of fiber per day for men. And those might sound like odd numbers, but today we'll explain to you where you can get the fiber from and how much fiber you're getting from some certain foods. Now, there are different types of fiber and they're not really all created equal. So when we're looking at fiber, you have two main kinds, soluble and insoluble. So soluble fiber is the type that dissolves in the water. So if you think of a cup of water and adding something like oats or bran or even legumes in there, it usually dissolves and forms a gel. So those are all kinds of soluble fiber, and what they do is they actually go inside your gut. They make you feel full for a very long time. They actually control your blood sugar and avoid spikes, so you're feeling full. You don't have these mood swings or these crankiness, and they just give you other health benefits like vitamins and minerals. And now when you're looking at insoluble fiber, I'd like you to think of a celery stick, something really thick. You can't really break it down. And the purpose of these insoluble fibers is to push all these toxins outside of your gut. So as you can see, different types of fiber with different roles in your body. And like I said, you should be taking around 25 grams if you're a woman or 38 grams if you're a man. Now, if you're looking at something like chia seeds, those are excellent sources of fiber. A tablespoon will give you around 5 grams. Avocados, believe it or not, if you have a full avocado, you're getting about 10 grams. Now, when it comes to fruits and vegetables, you're looking at about 3 to 5 grams depending on the fruit or vegetable you're having. If it's a cooked vegetable, 1 cup will give you around 5 grams, and then all the other ones will give you around 3 grams. And let's not forget our children. Fiber is also important for the children. You're looking at about 19 to 25 grams of fiber for them. Really important for them if you want them to be full. A nice big bowl of oatmeal for them in the for breakfast will actually give them a lot of fiber and keep them full throughout the day. We hope you enjoyed this nutritional report, and thank you for watching.
As we close today's episode, we remind our viewers that protecting your heart begins with awareness, understanding your numbers, recognizing your risk factors, and making daily choices that support long-term health. High lipid levels may be silent, but their consequences are not. With proper guidance and lifestyle changes, prevention is always within reach. Thank you for watching Medical Talk. Until we see you again, please stay safe and stay healthy.